struggling with addiction. I appreciate the tremendous compassion that not only impelled you to shed stigma and judgment and to embrace compassion, but also inspired you with the grace to invest your resources in this profoundly humanitarian cause. That is very special, and you people are even more special. On my behalf and that of the Government of Kenya, I thank you for the work you continue to do and look forward to enhancing present collaborations and partnerships into an effective addiction and related mental health management framework. It is scientifically established that addiction is a disease. We must urgently discard harmful myths and attitudes that persecute and stigmatize those struggling with addiction. Instead, we have to create an environment that is supportive and brings professional help within their reach. Most of us will know someone who is struggling with addiction to drugs and alcohol and have witnessed the ravages of the problem on their lives, on their health, employment, poverty, or social alienation. We cannot sit and watch so much promise to go to waste when solutions are at hand. And maybe it's an appropriate place for me to also confess that 2 months ago, I had to drive a member of my own family to a rehab who had walked out of her job because of drug addiction. And as I talk to you now, she's still in a rehabilitation center. So this problem is real, and it is at every level. Addiction, however, is preventable and treatable. Moreover, addiction rehabilitation services are effective in enabling people gradually recover. Obviously, a significant portion of attitude change towards addiction has to occur at the government level in terms of public policy management. Criminalizing addiction and addressing it through policing not only exacerbates the stigma around it, it drives affected people underground, outside the reach of rehabilitation and treatment as a health condition. Critically, it is not an efficient way of addressing root causes and prevention, which are best handled through education. We simply have to be efficient and effective about this problem, and we can afford to be human and compassionate about it. As we commemorate this International Day Against Drug Abuse and Illicit Trafficking, we also mark 33 years since the first rehabilitation center was established in Kenya. I'm told this was in Asumbi, Homa Bay County. Since then, the number of accredited centers have grown to nearly 200 facilities. The progress has been monumental, but there is considerable way to go. It is also worth noting that the majority of these facilities are run by non-state actors who have sacrificed their resources out of philanthropy and solidarity with the people suffering from addiction. Today, we will launch the National Rehabilitation Facility Operators Organization, to be known as Addiction Prevention and Rehabilitation Association of Kenya. As an umbrella organization, APRAK will bring together individuals, professional organizations, and facility operators to coordinate and enhance national focus on the prevention of addiction and rehabilitation of persons with alcohol and other drug addictions. Government looks forward to partnering with you and other stakeholders in accomplishing these tremendous tasks. It is therefore appropriate to engage in discussions about how government can complement these efforts in order to expand the reach of these services and scale up their efficacy, including the possibility of subsidizing cost, which remains prohibitive for a substantial proportion of needy cases. There are proposals for components of rehabilitation focusing on the management of health-related issues to benefit, for instance, from NHIF coverage for outpatient and residential costs. And I believe that it is worthy of serious consideration and action. It is time for us to activate the statutory rehabilitation mechanisms established by the Narcotic and Psychotropic Substance Control Act. In particular, the Rehabilitation Fund ought to be speedily established in order to make resources available to support the effective rehabilitation of more Kenyans who would otherwise be unable to access these services. The Ministry of Health will in due course issue appropriate guidelines on its implementation. And as part of the big plan we have going forward is on how to reform the NHIF, as you have had me propose, so that more people can contribute their fair share to the National Hospital Insurance Fund, as opposed to what currently is going on. At the moment, the lower cadre of our society, the people at the bottom, are paying more than people like myself. And I have said it's not fair. If everybody paid a similar percentage of their earnings to NHIF, we would raise probably another 60, 70 billion shillings every year. And we would be able to deploy some of that resources in management of addiction and supporting what you're doing. It is also necessary to engage county governments to ensure that outpatient addiction treatment services are available at all levels of our healthcare delivery system as per the Mental Health Act. Addiction prevention and management, as well as associated mental health dimensions, are actually a cross-cutting policy challenge that demand coordinated interministerial responses. This applies also to the need to harmonize standards of care, especially the alignment of treatment and rehabilitation with global best practice. To avoid a scenario where different service providers operate by some standards whilst government runs on another, it is also best that the Ministry of Interior and Coordination of National Government step in to develop an appropriate framework to facilitate this harmonized approach. The threat, and when I say the Ministry of Interior, I mean exactly what it is, because the Ministry of Interior has a network all the way to the villages, and it is good to begin it from there. And I agree with you that the model to be able to deliver and be effective is the bottom-up model. The threat that drug traffickers use and addiction poses to the youth as well as society is a pandemic in its own scale. The social and economic consequences of the problem are dire. we face the serious possibility of grave national vulnerability through the continued erosion of the potential that our youth embody. It is therefore time to join hands and act together with great urgency in eliminating the problem. The entire criminal justice system must develop appropriate strategy to combat drug trafficking in robust ways that do not criminalize illness or deny treatment to addicted persons. Courts should consider addiction treatment referrals as part of their interventions to enable corrective services fully integrate the rehabilitation of persons with alcohol and drug addictions. To facilitate these addiction rehabilitation centers and appropriate engagement with communities will go a long way in restoring hope, especially by customizing approaches to suit local contexts and employing traditional knowledge and societal, socio-cultural frameworks. And I agree with what my good brother was saying, that the community must play its role. And there is a lot of value that community knowledge and social issues can bring. And listening to Madam here, the interventions at the family, at the church level, at the community, all the way in schools and other institutions, all the way now to the professionals here, is a continuum that every stage we need to leverage on what every stage can do to manage this problem. Beyond optimism and ambition, we must fully engage our imaginations in developing solutions to the problem. Technological innovation to help deliver services as well as alternative therapies, including herbal treatments, alternative medicines, and spiritual practices should be facilitated. I believe that government policy that deliberately seeks to engage and employ all people in productive activity goes a long way in minimizing and mitigating vulnerability and susceptibility, disrupting the catchment population for addiction. Higher education institutions now have to mainstream addiction counseling and management into their teaching, research, and innovation curricula. I call on political leaders to desist from enticing young people with alcohol and addictive substances during campaigns. Instead, let us engage them on how we can use their energy and their talent to make Kenya prosperous, competitive, and innovative. Let us do our part to catalyze their tremendous transformative potential and avoid selfish and cynical acts that will enable the destruction or that will create the destruction of an entire generation. I remember one time I went to Bungoma and we went to raise funds for our border circle. And in the process of that function, one leader from that region, actually a member of parliament from that region, spoke to the occasion. And you will not believe that we have people who are sadists, and yet they pretend to be leaders. On this occasion, this leader stood and told this border circle group that the money that is going to be raised in this occasion, don't use it to buy, they wanted to buy a bus. Don't use it to buy the bus. Share the money and you can drink that money. Because this is not useful money. And he was speaking the local language. He didn't know that some of us understood the local language. So when I stood to speak on that occasion, and I'm saying it in public because there is a record of it, I told the young people there that while this gentleman is telling you to abuse this money that is being raised, he cannot say the same to his children. You know? And how on earth can a person who is a leader and who is expected to mentor and to speak to society in a certain way, you know, degenerate to the level of being a sadist to tell people you should not use resources given to them in a progressive, meaningful way. It is the same mentality that informs many of our leaders, and I dare say, who have a problem with people at the bottom of the pyramid being supported. When I was in university, I stayed at Ngando. I have told our member of parliament here. And I know Ngando very well. So a group from Ngando came to see me here with this good man. And they told me, Mr. Deputy President, we collect garbage as part of how we live. But we are a group of 50 young people. Because of this pandemic, we have run into trouble. Please, we need some support. So I asked them, what kind of support do you need? They told me that we need, ukitupatia mkokoteni kama 5, we are sorted. Because we know what to do. We will collect garbage. Our estate will be clean, and we will make some money. So I did that. And it became a very big problem to some of my colleagues, leaders, because they find that very problematic. Then you ask yourself, how is it your business? Yeah, how is it your business? And why don't you do that other thing that you think is better? So what I'm just trying to say is what you guys are doing in every way, small or big, contributes ultimately to the solution we have for drug addiction. I also call upon employers to scale up employee assistance programs that address alcohol and drug abuse, recognize addiction as a disease, and manage it as such. The dividend of such an approach cuts across the entire spectrum of society. Our schools, in particular, have a fundamental role in ensuring that the learning environment is safe for both learners and teachers from the predatory pressures and enticements of traffickers. This includes the physical environment, as well as information, sound education, and psychosociological support to reduce those mental and emotional vulnerabilities that create opportunities for addiction to take root. Adolescent management and positive youth development must be enhanced to fully engage the potential of our youngsters in an affirmative direction. Post-rehabilitation management is also essential to minimize the risk of relapse. Various programs must be encouraged to activate an appropriate affirmative component so that our brothers and sisters find their way back into productive society and stay there. Our republic is founded on national values and principles of governance that speak to us with a vital message today. At all times, the state and its officers must operate in ways that observe and enhance human dignity, social justice, inclusiveness, human rights, and which protect the marginalized. Human dignity is expressed as a fundamental right under Article 28 of the Constitution. It is clear from the architecture of our governance that there is an unstoppable resolve by the people of Kenya to become a just, inclusive, and compassionate society. I see this compassion as extending to all persons, especially the vulnerable. Our work with persons struggling with addiction is therefore a big test of how compassionate we as a people are. I am grateful to all the stakeholders who have made this commemorative event and launch possible. I commend my brother here and Daktari and everybody else. The noble work done by APRAK, ISSUP Kenya, NACADA, and the Global Fund in anchoring initiatives to highlight this critical subject and to build knowledge and acceptance around it. As a result of all this work, Kenya is now ranked 5th globally in terms of capacity to handle addictions. Well done, and keep up the very brilliant work. It is my pleasure to declare this event, ladies and gentlemen, officially opened. I am also honored to preside over the launch of the National Association for the Prevention and Rehabilitation of Kenya, APRAK. Thank you very much, and God bless you. Asanteni sana. Thank you.